Rheumatoid arthritis is an autoimmune disease that causes swelling, stiffness, pain, and redness in joints on both sides of the body. It typically concentrates more on smaller joints and often begins with affecting the joints connecting the finger and toes. Unfortunately, it afflicts more than 1.5 million Americans, with women being 2.5 times more likely to fall prey to it than men. It doesn't even have a known cause, although genetics and the environment are thought to play a part. However, it may not be fatal, but it may lead to serious deformation of joints, which causes great problems with general mobility. So it's always a good idea to be on the lookout, and it is an ailment nevertheless and should be taken seriously. Unfortunately, rheumatoid arthritis isn't 100% curable, but certain treatments include medical intervention that may slow down symptoms and physiotherapy. Modern physiotherapy can help us deal with a series of health concerns and is also one of the best treatments for rheumatoid arthritis. That's exactly what we'll be discussing in this video. Stay tuned if you want to take preventative action or if you already suffer from the disease. We're going to be going over a few exercises and tips for physiotherapy that you can perform on your own to help maintain healthy joints, relieve pain, and slow down symptoms. Hang in there, we're with you. With the disease most severely affecting smaller joints such as in the fingers and toes, let's start off by learning a few hand exercises. Since your knuckles connect your whole finger to the hand, it's necessary that you exercise your metacarpophalangeal joints, that is, your knuckles joints. A simple exercise may begin with raising your arms upwards and stretching your hands to their fullest with palms facing outwards. Then, one by one, bend each finger only using the knuckle joints and make the fingertip touch your thumb. Do this slowly and repeatedly with both hands doing it simultaneously. For example, doing it with the index finger on both hands at the same time. This is an excellent exercise that requires no radical movements and shouldn't cause you much strain. It'll keep the joints at your knuckles working properly and prevent any pain, since any pain in the knuckles is not isolated and transcends into the entire finger. Do this as much as you can with regularity. Having worked the knuckles, the next exercise focuses on the rest of your fingers. One is called finger curls. Palms facing outwards and fingers touching each other, stretch out your thumb. Then, slowly curl your fingers until your fingertips touch your palm. And then, gently cross the thumb over to make a loose fist. Gently reopen to achieve the starting position. Repeat this multiple times. Another exercise for the entire finger should see you place your hands on a flat tabletop. Stretch out the hand and then gently lift each finger as high as you can one by one. Keep the finger up for a couple of seconds. Repeat this slowly and gently. This should not only keep your joints mobile, but also help in relieving pain, since the tendons are stretched and when relieved should be relaxed and free of pain. Next, we're going to move a bit upwards to the wrists. This series of exercises should essentially encompass every movement concerned with the wrists. Firstly, with a loose fist, place your hands on a flat surface in level with your view. Then, rotate the wrists outwards to make the palm side of your hands face upwards. Once done, hold for 2 seconds and slowly rotate in the opposite direction to make the palms face back down. Repeat this a number of times. Once done up to a satisfactory number of repetitions, lay down your arms, hinged at the elbows, on a table for support with the hands hanging down off the edge. Make a loose fist and rotate the wrists, with the palms facing strictly downwards in clockwise motions for 5 complete circles. Afterward, do the same in anti-clockwise circles 5 times over. This should be a substantial basic exercise that will keep your wrists functioning optimally and help prevent pain. Just as with hands, joints in the feet are also adversely affected due to rheumatoid arthritis. Hence, special consideration to foot exercises should also be given. Particularly smaller joints are affected, so the toes are of crucial significance. Sit on a chair and gently lift one foot to rest it on the opposite knee. Grab the heel with one hand and the toes with the other. Gently pull the toes backwards for them to be facing the knee of that respective leg. Pull until you feel a decent stretch on the bottom of your foot. Hold for a few seconds and then gently guide the toes back to their original position. Once back, push them downwards further from their resting point until you feel the same stretch on the top of your foot. Keep the toes in position for a couple of seconds. Repeat this process 4 to 5 times and then move to the other foot to do the same. Once done, place your feet back on the ground and let them point in their natural direction. When they reach this resting point, stand up. Once up, move each foot outwards while keeping the heels in place and hold for a few seconds and then return. Next, do the same but now pointing the feet inwards and hold for a few seconds before returning to the starting position. Repeat the outwards and inwards motions while strictly keeping the heels in place 3 to 4 times. After this has been done, the final foot exercise can be done. For that, place the ball of your feet on an elevated flat platform that is 3 to 4 inches higher than the ground. Gently loosen the hold and let your heels touch the ground while keeping the ball of your feet in that elevated position. Be sure to do this next to a railing or table to help yourself keep support should you seem to trip. Hold this position for a couple of seconds. These exercises should be sufficient to keep your feet and all the joints are there and working perfectly and minimize pain. Although rheumatoid arthritis most severely affects smaller joints, other joints such as the elbows, shoulders, hips, and knees may ache too. For them, make sure you keep yourself moving in one way or another. In your daily exercises, make sure you move every joint in your body sufficiently, and use all possible movements for each joint. However, please be gentle, since excessive force can make matters worse with an already given predominance of inflammation. Tai Chi, stretching, yoga, and very lightweight training may be good options to keep your body, especially your joints, healthy and pain-free. A simple walk in the park works wonders too. So long as some sort of light exercise is taking place, you can easily work your knees, hips, elbows, and shoulders with a brisk walk. Be sure to stretch out your shoulders all the way up to allow yourself to use that ball joint to its fullest, albeit with care. Be careful not to do anything too strenuous, including heavy lifting. When symptoms are severe on any particular day, it's okay to rest instead of forcing yourself to exercise, since any wrong move may further worsen the condition. However, should there be no exceptional severity, please be consistent since too many lost days bring you back to the starting point and all progress may be lost. If you feel excessive pain and feel too immobile to work on your own, please make sure you have a licensed physiotherapist to assist and guide you. With this, I hope you liked this video, and more than that, I hope this video was of some help. If you're suffering from rheumatoid arthritis, my prayers are with you. Don't lose hope. It may get annoying, but as long as you're doing your best, you're doing great. Please like and comment and also subscribe. Keep watching Health Empire. Until next time.